Hi, this is Mace Hara for the Medical Sales Channel and the Medical Sales Guru podcast. This is a combined episode. Today I want to talk to you about the passion factor in medical sales, because while everyone knows what it means, the true value of selling with passion often gets twisted around, so I want to address that. First of all, you've probably heard me say this in the past, and I mean it with every fiber that's in my being. Sales representatives who are able to sell, who are passionate about the product or service that they are selling, will outsell those who are not. Why is that? Well, think about it. A lot of people, your competition, hopefully, are in medical sales because of the dollars involved. Now, that's not a bad thing. It's not a bad thing at all. This is a business, and I'm going to get back to that in a moment. But when you're dealing with healthcare providers, these people take care of patients. In other words, their lives are truly in their hands. That's not just a metaphor. They are truly taking people's lives into their hands. So the decisions they make in terms of buying products and services, they have to know that there is a level of confidence behind it. So here's where the passion comes in. A sales representative who is truly passionate and is able to convey a level of confidence through that passion, that is going to resonate not only at a conscious level with a healthcare provider, but also at a subconscious level. It might not be palpable, but it is being felt by the provider. So the sales rep who truly believes that his product or service can make a difference for the patient and the provider, they have a distinct advantage. The first takeaway message is that if you're not passionate about what you're selling, if you don't believe that your product or service can make a difference for the doctor or the patient or anyone else involved, then you're not going to be very successful doing it. Would you agree with me on that? Think about it before you answer if you're saying no, because it makes a huge difference. Now, here's the next thing. A lot of people get into medical sales because of some event in their lives. I get calls all the time from people who tell me, I want to get into medical sales. My father was involved in an accident. He had to have surgery. The products that they used on him in the operating room weren't that great. I think if I was representing one of the companies that had good products, I'd go out there and make a difference. Very true. Great way to sell. But here's where I got to caution you about that. Healthcare and medical sales, while it is about patients, and you know my motto, the patient always comes first. I believe that absolutely, and you must also. But the reality is we're in a business, and part of this business is helping healthcare providers and any of the other buyers or people involved in the buying decision. It's helping them to make good buying decisions, which means helping them to make good business decisions. So here's where you have to be able to separate the passion from the business. Somewhere in the middle, they will meet, but you have to have a very distinct value proposition that supports the economics of healthcare, that supports the healthcare provider's personal economics, personal goals, personal things that are driving him in the practice and in his or her life. You must understand these and you must address them. But you also need to have that passionate component. Let me give you an example. A couple of months ago, I worked with a sales representative named Rob. Now, Rob is one of these people who got into the business because he's very passionate about making a difference in people's lives. But here's what happened. When he got in front of the doctor, he would go into his sales presentation, and his sales presentation was almost solely focused on Rob's reasons for wanting the doctor to use the product. In other words, doctor, this can make a patient healthier. This can make a difference in the patient's outcome because my device, my product is superior to what you're using. And if you're going to continue to use what you're using instead of my product, then you're really being unfair to your patient. And you're not going to be giving them the best possibility of a great outcome. Well, as you can imagine, this was not very well received by the doctor because doctors, while they are human beings, and they do think and they do buy and they do make decisions on emotion, they are trained primarily to make decisions on data, on science, on facts. In other words, to look at the empirical evidence on how a particular product or service is going to impact their patients. Because here's the bottom line. It doesn't matter what they feel. Sure, sometimes they will make decisions on products or services based on their gut feelings. But ultimately, at the end of the day, there has to be good scientific data supporting that. Because one thing we all know about healthcare, and this is not a shock to anyone listening, is that there is always the risk of liability in healthcare if healthcare providers don't make decisions based on good science and good supporting data. So you can't separate necessarily the emotion and the need for scientific support for whatever you're selling. But your sales presentation must have both of those elements. So yes, passion is critically important when you're selling in healthcare, or really anything for that matter. And I think the most important thing about passion is that it's going to instill in you a level of belief that really can't be found anywhere else. It can't be communicated through any other means. But the true passion has to come in a subtle way. The passion has to come across in the way that you're confident, that you believe in what you're doing, but ultimately that what you're talking about is going to be best for the provider based on the information that he or she gives you, which again goes back to having good questioning skills so you can position your product appropriately such that it's a good fit for the provider, and that it meets the doctors or the healthcare institutions or whoever the healthcare providers are, it meets their business goals and their business needs. Because we could talk all that we want about healthcare taking care of patients. It's very true. It's all about the patient ultimately, because the patient is the ultimate beneficiary of what we all do. But the bottom line is, if the doctor does not make good business decisions, if the healthcare institution does not make good business decisions, they're not going to be able to keep their doors open. And if they can't keep their doors open, they can't take care of their patients. So you have to really approach every sale with this all-encompassing viewpoint, kind of a 30,000-foot viewpoint. And then you have to really narrow it down as you go deeper and deeper to be able to focus on exactly the deliverables that healthcare provider is looking for. So sell with passion, but also sell with data, sell with science. You'll make the connection, you'll get the sale, and when you do that, the patient will benefit. And don't forget, whatever you do in your medical sales career, the patient always comes first. Thanks for spending some time this week on the Medical Sales Channel / Medical Sales Guru podcast. This is Mace Haroff. I will talk to you again soon. Bye for now.